Hey YouTube, it's Casey. Today is June 26th, which makes it 1 year since I had my top surgery. So I figured it's about time that I do an update video. I had my top surgery a year ago, and since then a lot has happened. For the first month I had to wear compression, and then after that I was able to stop wearing compression. And after about 6 months, I started moving my arms around a little bit more. I waited the full 6 months before I really started moving my arms around because they say the first 6 months is when you have the biggest chance of stretching out your scars. But even this whole past year, I haven't reached up above my head too much, even though I know I can, because it's even though the first 6 months your chest is going to change the most, it's going to really settle within the first year or so. So that's something I've been conscious of. As soon as my incisions healed up and the scabs were off of them, I started using a bunch of different scar care on them. They say that the scar care that is really the only one that's been clinically proven to work is the silicone type. So I've been rubbing different types of silicone gels onto my incisions. I did try using the silicone strips, but since starting in testosterone, I've developed a bit of um, I'm a little bit sensitive to adhesives for band-aids and tapes and stuff, so apparently the silicone tape is no exception to that. I also have two drain holes up about here on each side, and those I've actually been experimenting with because they're about the size of a hole punch in a piece of paper. So on this side I've been using vitamin E oil, and on this side I've been using bio oil, just to kind of see what sort of difference it would make. And for the first few months they both looked the same, and then the next few months, the one that I was using the vitamin E oil on was the scar itself was a little bit raised, and the bio oil one was a little bit red. And that's something that I've heard that bio oil can do, actually. But it's been a year now, and a couple months after that happened, or even a few weeks after they initially started looking different, they both look exactly the same now. So, as of a year out, I'd say that vitamin E oil and bio oil do the same in terms of scar care. I'd say the biggest difference between them is that the vitamin E oil is a little thicker and the bio oil is a little bit thinner, and it smells a little bit better. But and the bio oil is more expensive than the vitamin E oil, but I'd say they work about the same. My scars have been healing really well. I haven't let them go into sunlight at all. Again, when you don't want to expose your scars to sun before a year, because that's going to make them darken and get redder. Um, Luckily, I haven't really had too much issues with them. The scar on this side is a little bit thicker this way than this scar, and that's fine. The skin on the chest on this side got pulled a little bit tighter than on this side. Um, I would say that is a bit of something I'm a little bit unhappy with, is that a little bit too much tissue was taken out of this side of my chest, so the chest wall itself is a little bit wavy like this, but I was thinking about possibly going down and seeing if my doctor could do a revision for that, because revisions are covered, but I'd have to fly out of state and stay somewhere and all of that stuff. So at this point, it's not something that I'm too concerned about. Um, I do have some little hairs starting to grow in on my chest, more so than before I had top surgery, specifically right down the center of my chest, and I have two little spots where my nipples were. I did go without nipples, so I didn't have to deal with that at all during the healing process. I didn't have to deal with anything to do with the nipples. But overall, I'm pretty happy with how my surgery's gone. I do wish that a little bit more had been taken out in the armpits areas. I had my doctor liposuction right in here to kind of get some of the fat out, and honestly it looks exactly the same as it did before. So if it wasn't for the fact that I had a lot of bruising right there after surgery, I'd almost think that he didn't do it, but I did see the bruising from the liposuction there, so I know it was done. So I guess it wasn't a significant amount wasn't taken out. But overall, I'm pretty happy with my top surgery, and I've been working more on getting my range of motion back. Like I can reach above my head and stuff, but I still try not to too much. But now that it's officially been a year, I can start doing that a little bit more. In terms of sensation of my chest, it went through. It's kind of weird the way I describe it after having surgery. I've had surgery on my ankle as well before, and it feels like when you're post surgery that your skin kind of feels like if your foot falls asleep and you kind of like lose feeling in your foot, it kind of feels like that. Like it's extra sensitive and also numb at the same time, which sounds really bizarre and like it wouldn't make sense, but somehow that's what it feels like. So I've gotten a lot of feeling back in my chest. Below my scars, I have total feeling. I never lost any feeling down there, but above my scars, it's a little bit numb in areas still. Like I can feel things now. It doesn't have as much of that foot falling asleep feeling, but there are areas that I can feel more than others, and that's areas where like uh, more tissue was taken out, and it doesn't feel like the same as like other parts of my body. Like when you like touch your skin or something, and I'm hoping that eventually some of that will start to come back. It is still working on coming back, and it's interesting because the areas that like are numb that I can't feel as much, it doesn't respond to temperature. So like I'll get goosebumps on my chest, and like the areas that are more numb, it won't get goosebumps. Versus the areas where I can feel a bit more like other parts of my body when they get cold, it will get goosebumps. So that's kind of interesting to just kind of see how the nerves connect in that way. I think that's about it. I didn't really think about too much to say for this. In about a month, it is going to be another update video for. I'm getting close to 3 years on testosterone, so I'll do another video in about a month. But for now, I think that's all. I am going to try and make some more videos, and I know I keep saying that all the time. But I really do want to keep trying to make some more videos and talking about health insurance and some of the things that I've encountered since having top surgery. So hopefully I'll get around to doing that. But this is my check-in 1 year post-op.